For sure.
Good morning, everyone. And so great to see everyone. For those who are not here with us in person, we are going to record this. I think our live streaming may have a little bit of some bugs, but we definitely want to share the conversation this morning and tomorrow afternoon. Let me introduce myself. My name is Liz Morales. I am the Director of Housing and Community Development for the City of Tucson. I'm just here to say thank you for your work. Thank you for caring about this very important topic today. You know, one of the things I always want people to understand, you know, working for the city is a great privilege. When I started working in the field of homelessness, back 2001 is when I started working on this issue. And I quickly learned that we need champions who have influence to bring people together on the issue, to rally and gain traction. And more importantly, to those who have the ability to commit resources to this need. Since I've come to Tucson 3 years ago, I've been energized by the champions we have in the city of Tucson and Pima County at all levels. We do have some great champions here representing our mayor and council. I want to acknowledge CJ Young with Ward 3. And I know Ann Charles is trying to join us. I don't see her yet. She may be trying to stream us right now, but we have all our ward offices and the mayor, Mayor Romero's office have been great champions on this topic. Also at Pima County, we have some board of supervisors that just really care about this topic. So is there anyone here from Pima County? Oh, no, awesome, right? There you go. We have some people, so thank you to our friends from Pima County. You know, we've made homelessness, serving those who are unsheltered a priority here in Tucson and Pima County. We also have our business and nonprofit leaders who lead on this issue because they know our community the best. And I want to thank you for being here as well. And I want to acknowledge Tom Litwicky, Dan Ranieri, and also United Way. Lisa is here with United Way. We have some great champions here in them. If I missed anyone representing your organization, so my apologies. But those of you who do, I call it the frontline work, working directly with our neighbors and residents that are unsheltered, please raise your hand if you're doing this direct service work. Awesome. Let's give them a round of applause. And challenging but rewarding work. And finally, I want to just acknowledge and I hope I don't put you guys on the spot, you guys and gals, our residents that are residing at Wildcat Inn, people who can bring the voice of lived experience. I want to just acknowledge all of you and thank you for being here. I want to thank Community Foundation for Southern Arizona for this amazing space and opening their doors to us. This is just going to be such a great 2 days for us to work together in this space. Of course, I cannot not mention TPCH, which many of you are members of Tucson Pima Collaboration to End Homelessness. The work that you all do on behalf of our region is so critical. We bring in, I believe, Jason, over 11 million a year to Tucson from HUD through TPCH. And I want to acknowledge the chair, Jocelyn. Where are you? There you go. There's our leader for our TPCH. Thank you, Jocelyn, for being here. A lot of the work that's going to be happening in these 2 days is very critical for us to get more funding from HUD. So there's some planning and data analysis that has to happen. And we're using these 2 days to do that work. And so again, thank you for all of you for committing to 2 days to do this. And I can't also not acknowledge my amazing co-workers, my team members, that do this work on a daily basis, for organizing this. So those of you who work for City of Tucson Housing Community Development, please raise your hands. Thank you, guys. So we're here today to tackle an issue that matters to us. We all have different perspectives and reasons to be participating in this conversation. What is important is that you have shown up today at this time to be part of the solution. I don't want to pretend that what comes out of today will solve the problem for all persons experiencing homelessness. But what we know is that by coming together, analyzing data, and looking at the full and complete picture, and by taking inventory of our finances and resources and committing ourselves to this work, people's lives are changed one at a time, with the hope and determination that we are making an impact in our community for the good. It may not be apparent right away, but we don't give up. We keep going until everyone has a home. Unsheltered homelessness is on the rise in our community. According to this year's point in time count, at least 1,600 people are sleeping outside each night. In 2022, our point in time count of the unsheltered was exactly 1,649. We won't all agree on the approaches today. I've heard from many in our community that are asking, we need to do more, like sanctioned encampments. We need to do more, buying more buildings, empty buildings, turning them into shelter. Let's do more tiny home villages. Those are all valid points of view that are born out of true concern for our unhoused residents, a desire to treat them with dignity and worth. There is no disagreement. In a time in which we are living with finite money, finite resources, and finite available units, we must invest wisely and invest in interventions that have been proven to be cost-effective and have the best outcomes for ending a person's episode of homelessness. We must use those interventions that quickly move a person from an unsheltered to a stable environment where they have access to services and supports and allow them to reestablish themselves. I've often heard from people saying that have come out of homelessness saying, I can finally feel like I'm part of my community again. I can give back now. And we want that for every person. Today, one of our interventions we're going to be hearing about is called Fuse, and I'm not going to go into it, but just know it's a targeted approach. It's a housing first approach that requires unity and teamwork across the community. I found a quote that I really liked from Henry Ford, who, as many of you know who Henry Ford is. He said, coming together is a beginning. Keeping together is progress. Working together is success. Today will be a great start, but it will be through consistent meeting and working through hard challenges that will make the progress that we need. Addressing unsheltered homelessness requires bold action and strong collaboration. We've already seen this in our community. This is not new to us. Our region has done amazing work, and it is worthy to be recognized. As I share these wins, will you please join me in celebrating these accomplishments just by saying, we are grateful for this work. Can you guys try it with me? We are grateful for this work. So let me start. Pima County launched the Emergency Eviction Legal Services, also known as HEALS, program, which is providing legal representation, system navigation, and emergency housing for people facing eviction. We are grateful for this work. City of Tucson and Pima County distributed over $63 million in emergency rental and utility assistance in partnership with Community Investment Corporation and a network of community providers. We are grateful for this work. City of Tucson has acquired and opened 3 bridge shelter properties serving over 80 individuals nightly. We are grateful for this work. The TPCH Youth Homelessness Demonstration Project has added nearly 100 beds for youth and young adults experiencing homelessness in our community. We are grateful for this work. 128 households have transitioned to permanent housing through the Emergency Housing Voucher Program administered by the City of Tucson and TPCH. And 47 additional households are vouchered and looking for a home today. We are grateful for this work. The Pima County Housing First pilot and the work of Jail Population Review Committee have demonstrated that intentional collaboration and intensive supportive services can successfully interrupt cycles of homelessness and incarceration. We are grateful for this work. The network of community nonprofits, government, philanthropy, mutual aid organizations, and faith communities working to address homelessness continues to grow. We are grateful for this work. Thank you for joining me in that. We're making great progress, but there's still much to be done. Over the next 2 days, we'll spend time in small and large groups discussing the opportunities and challenges that lie ahead and how we as a community can work together to achieve our shared goal of Tucson, which is everyone has a home. So now a few housekeeping items. For those of you that have your tablets, laptops, phones, there is the Wi-Fi information. It's also right at the top there. You'll hear about Slido. So if you haven't done it yet, either use a QR code or the access code. Restrooms are located right to the right as you exit the auditorium here, and you'll do a quick right and another right. So we are at capacity, so just attend those events that you registered for, because I think we're going into separate rooms, so they are limited. Snacks and beverages are available in the lobby. Excuse yourself as needed if you need a drink, you want to have another snack. And finally, we'll break at 12 p.m. for a 1-hour lunch, and we hope you'll enjoy those local restaurants. Any questions before I turn it over to our guest here? Did I miss anything, Jason? Awesome. All right, so we are so fortunate. Corporation for Supportive Housing has been an amazing resource and change maker for not just Tucson, Pima County, but for many communities across the country. We have two amazing, I don't want to call you guys moderators. That doesn't capture what you guys do. I'm going to call them change makers too, because they've done some amazing work. So let me just say thank you, and please help me welcome Margaret and Ian.
Hi, everyone. We're going to do introductions in just a minute, but I just wanted to give you a little bit of overview on Slido. If the slide here was not enough, please do access either the QR code or join by phone or your mobile device by going to slido.com and entering the code there. It's a really great way for us to interact with you. We're going to ask some questions that you can use your phone to respond. Either there are going to be some open text questions. There's going to be some multi-select questions, no quizzes, I promise, no homework. But then the other really cool thing is, as you have questions and want to have remarks, you could just put them in Slido as well. There's a section for Q&A. So as questions pop in to your head, as remarks come to your head, put them into the question, and there are going to be some set times where we'll go through and review them together and get responses for you. So I know for me, when I'm when I'm in the audience, I have a lot of questions. This is my nature, and I sometimes forget like half of them. So please just put them into Slido. If you have any questions or technical issues, we'll definitely have breaks. We're not going to sit here for 3 hours, so we'll have some 10-minute breaks in between. So if you have questions or you can't get it working, come on up, see me, and I'm happy to help you. Great. All right, thanks.
It's impossible to follow Liz here. But I do just want to take a minute and introduce myself, although I feel like I'm in church now, so it feels really good. So my name is Margaret Adams. I'm a senior program manager with CSH, with the Corporation for Supportive Housing, as Liz mentioned, and I'm really pleased to be here today with my colleague Ian.
I'm Ian Costello. I use Ian pronouns. I'm a program manager at the Corporation for Supportive Housing, and thank you so much for welcoming me to your community. I live in Pasadena, California.
And I've had the pleasure of being able to work in Tucson quite a bit. So I'm happy to see a lot of familiar faces in the room. But for folks who don't know me or who don't know CSH, we just wanted to say a little bit about what CSH is. So we do a number of things, right? We provide consulting and technical assistance. That's sort of what we're here doing today, right? And a lot of the work that we've done with the county, TPCH in the past. So we will work with community on very specific activities, right? So when TPCH said we want to do a Fuse initiative in Tucson, right? That's part of that sort of consulting and technical assistance piece, right? We also provide training and education. So we have an amazing training center that you can go in and look at all of the training that's available around supportive housing. As you can't tell by our name, we're really interested in helping communities increase high quality supportive housing in their communities, right? But our training and education center, you can access just about anything you could want related to training on all aspects of high quality supportive housing. We also work on policy and advocacy. So we know that, as Liz mentioned, we really have to do some sort of cross systems, cross sector work together in order to solve some of these really complex problems that we're facing in our communities, right? So we work on the policy level. We know that we might need to change some of our policies and practices in order to do this work more effectively. And then, of course, we're also a lender. So we are a community development finance institution, a CDFI, and all of our lending is really mission oriented and directed at helping communities, again, increase the supply of supportive housing in their communities, right? So we want to know who you are.
We're gonna test it out. Here we go. Our first slide up. So there's going to be a section on your phone called live polls or something like that. And then you should be able to make your selections, as many as apply. I think there's more options than are shown on the list. Great, yay. Whoever put it in. Excellent. Great, yay. I'm so glad this is working.
All right.
Excellent. I hope everyone can share my excitement, or at least like 50% my excitement. I'll be very pleased. Cool.
All right, a lot of service providers here in the room today. We've got government, people with lived experience, a lot of something else. If you're something else and you're comfortable raising your hand and sharing. Yeah.
I live right down the street from this community center, so I'm excited to be here. I myself just noticed what's going on with the treatment of the homeless population. So
Yeah.
wanted to come see what kind of resolutions you guys are providing, what kind of options there are to do this.
Excellent.
Welcome.
Thanks for being here today. Thanks for being here today.
I started in housing with the community organization in the city. We did we went through proposals for blocking funding. I did that for about 7 years during the meeting. After one, I was committed to the health community. I've always been interested in housing from our community.
Perfect. Thank you so much for being here today. Yeah.
My name is Juan. I'm a therapy in the community. I'm a community coordinator for the housing equity lab. That's going to be one of the community. These are not the things
I hope you're gonna stay all day today. I hope I can just touch you tonight. Oh, great. Great.
My background was and so I work with people all day long.
Thank you so much for being here. Really appreciate all of you sharing that. So we wanted to just sort of give you a little bit about our agenda today. We've kind of gone through some introductions. What we're also going to talk about is doing a level setting run. So Liz mentioned that TPCH, the board has approved a Fuse initiative, and we're going to talk about what that is and what that means, and what we're going to be requesting of you all over the next few days together. We're going to talk a lot about data, right? And that's Ian's going to help us with that conversation. But we need you to be looking at these data with us, to be talking about how these data feel to you, how, what can we learn from these data, what are missing. So we really want to dig into this with you in conversation with everyone in the room today. And then we're going to talk about partnerships, right? Liz talked about all the great work that's happening in your communities. We know that there is incredible support for moving the needle on reducing homelessness in Tucson and Pima County. We know this. We know that so many great things are happening, but we also know that we need to sort of think about those partnerships that are already in place and think about what needs to be shored up a little bit. What opportunities do we have, and what are some new partnerships that need to be created? So we'll talk about that, and then we're going to wrap up before lunch today. So we're going to talk about this Fuse initiative, right? What is Fuse, right? Fuse stands for Frequent User Systems Engagement, but really what we're talking about is a process and an approach by which we're really looking at a community and thinking about how can we identify and prioritize folks in our community who are cycling through multiple systems of care, right? They might be hitting our emergency room or the CRC, or cycling, getting booked in and out of our jails, right? They might be using our emergency shelters. But these are folks who really need some engagement and connection to resources, right? Housing first, and then of course those services that folks want and need. But we often find that the resources for those things might not match the needs of the folks, right? Folks, the homeless response system might not know what's happening on the jail side, right? And when we think about the resources that are being deployed for folks, they might not be aligned very well, right? This is often what we find in communities, that we've got a lot of resources going to things, but maybe they're not aligned very well. And we want to think about how we're focusing on those crisis interventions, right? Those emergency rooms, jails, right? When we're thinking about high cost to community, right? Liz mentioned that we're really thinking about how can we implement programs and revise our work that we're doing together in ways that are strategic, coordinated, and are really thinking about these reducing costs on these emergency interventions, right? We want to make sure that folks aren't cycling through emergency rooms, right? That we're actually giving them the right kinds of resources that they need. So when we think about a Fuse initiative, our solution to that, or one of the solutions to that, is thinking about the data that Ian's going to share with us in a little bit, right? We need to understand who is cycling through these systems of care, right? And what we find, and what we found already when we're working with Tucson and Pima County, right, is that our data are not, it's not easy for us to look at who's in our homeless management information system or our homeless response system data and understand who's cycling through our emergency rooms and understand if those same folks are cycling in and out of our jails, right? And so what we're trying to understand through looking at these data, and we're going to start that conversation today, is who is cycling through these systems. And if I find someone who has been booked into jail 10 times, but has never used a day of emergency shelter, but they are experiencing unsheltered homelessness in our community, right? We want to be able to, the homeless response system wants to be able to know who that person is, right? So we want to think about how can we better understand who is hitting multiple systems of care, right? We also want to think about this relation to equity. So we're going to talk about equity. We're going to talk about, disparities. We're going to talk about sort of how we can apply sort of a more equitable approach to how our resources are being distributed in our community. And then, of course, we want to make sure that as we're thinking about crafting responses, as we're thinking about changing our policies and our practices, the way we do this work together, that has to be done in partnership with those folks who are closest to the issue, right? So if we don't have folks who have experienced, have been impacted by the justice system, if we aren't talking about folks who have been impacted by the healthcare system, if we're not talking to folks who have been have had experiences of homelessness, we're not going to likely generate solutions that are going to work for those folks, right? So we want to make sure that we are bringing the voices of lived experience. So just a little bit about Fuse, right? Fuse has and this is probably, it's probably a lot more than that now, but more than 2,600 units of supportive housing in communities that have successfully launched the Fuse initiative. And one of the things you're going to hear from us a lot today is how a Fuse initiative and how this approach can really help communities think about reducing jail, shelter, and healthcare utilization and increasing housing stability for folks. And then, of course, as Liz mentioned, we've got resources that we need to think about. And so how can we align those resources to really be strategic and think effectively about the work that we're going to do together. So this is just a little a map. Again, you can see Pima County on the map here. But this is just a map of where Fuse initiatives have been deployed. And we'll talk about some of those. So we want to talk about Fuse as a process, right? And sort of what are we hoping to accomplish as we move through this process together, right? First and foremost, it's housing, right? We know that if folks are experiencing unsheltered homelessness in our communities, what's the solution? Housing, right? We know that housing is the only thing that's going to end homelessness in our communities. But the other thing is that it has to have services, right? We can't have supportive housing without supportive services. So we really got to think about creating that housing supply and the supportive services that match the needs of the person, right? Because we can't just kind of force people into housing interventions that aren't going to work for them. That's not going to be successful. So we're really going to spend a lot of time thinking about what are those services and housing that folks really need. Once we do that, we know that we're going to get to the data are going to show, we're going to look at examples from other communities, but what we've seen is that health outcomes are improved, right? We know that when folks are stabilized in housing, that they can start to think about caring for themselves, thinking about accessing the kinds of healthcare that maybe they weren't able to access when experiencing unsheltered homelessness, right? So we want to think about knowing that when we are doing this successfully, we're going to have improved outcomes for people. It's going to increase housing stability. And then ultimately the goal is to reduce those episodes of being booked into jail or needing to access the emergency room, right? And then what we know is that ultimately is going to create a more cost-effective, so not only helping both thrive in communities, but it's also more effective use of resources and service delivery. So it also is a way to think about systems alignment and sort of thinking about how our organizations and our systems work together, right? So we're thinking about sort of some of these activities, where we're going to sort of think about what is that housing and resource allocation. We're going to identify what are those resources that we can use today. We're going to think about the introduction to the data matching. Again, right, this is sort of our first step in thinking about what even is the scope of our problem in our community, or what is the scope of the issue in our community. Again, I talked about that sort of cross systems engagement, right? We've got to have the health system, we've got to have crisis, we've got to have the jails, we've got to have the homeless response system all at the table to talk about how we can work together more effectively, right? As I thought that quote that Liz gave us is just so on point for the Fuse process. We're going to connect folks to supportive housing. We're going to measure, though, our results along the way, right? We're going to think about how are we thinking about these data, and how are we thinking about our work together? How are we going to measure that? What are the benchmarks that we're going to be looking for? So we're going to begin to set some of those things up together over the next few days. Right, and then we're gonna ultimately we're gonna expand, right? We wanna get to that place where we've got a great foundation and we're able to scale this initiative to meet the needs of folks. So I want to talk a little bit just about what is supportive housing, right? I found that if I ask 10 people what is supportive housing, I'll get 10 different answers.
Maybe even 12.
So I want to just do a little bit of grounding from CSH. What do we mean when we say supportive housing, so that you know what we mean when we're talking about supportive housing. So it is a cost-effective solution that produces lasting results, right? But at the center here, we've got affordable housing, right? So we know that we need affordable housing. We've got to increase the stock of affordable housing, or vouchers, rental subsidies, whatever that is, but we've got to have that that affordable housing in the center, right? Housing is the foundation. But then we've got to wrap all these services around the person, right? I said earlier that when we think about supportive housing, it's the supportive services are the sort of key to that, right? So we've got to make sure that housing is affordable, that housing is permanent, that folks have an independent lease, right? And when we think about the supportive services, they're flexible, right? So not everyone is going to need the same level of services, right? So we want to make sure that we can flex those services to what the person wants and needs. Those services are voluntary, right? So we're not attaching the services to the housing as a requirement to keep the housing, right? You got your housing. We're going to keep coming at you with the services, but whether or not a tenant accepts those, that's really the challenge for our services community, right? But they're voluntary for the tenant. And then these are person-centered, right? So we're thinking of every person in supportive housing as a unique person with their own determining wants and needs, and our housing and services need to match. So we've got a little quote here from CSH, but basically this is sort of what we're talking about. And then we know that when we do this in communities and we do it well and we do it to quality, we know that it strengthens partnerships, right? We know that it improves services delivery for people, and we know that it helps us use our resources more effectively. So I'm going to turn it over to Ian to give a little overview of our process.
Thanks, everyone. I feel like I need to introduce myself again, but I'm Ian Patello with CSH. So I've worked in maybe a dozen, maybe a little over a dozen communities at different stages of the Fuse process. We have put it into 3 different categories, from planning, implementation, and scaling and replication. And we have these nice, neat 10, here are 10 steps to getting a Fuse project. Of course, it doesn't exactly work according to this very nice, neat layout of how a Fuse project gets established. There are steps that we skip. There are steps that we come back to. There are steps where we start maybe in the middle. So when I show you these 10 steps, I don't mean that it's a longitudinal, logical flow. First you do 1, then you do 2, then you do 3. This is just a way to conceptualize it. We might start at 3, but then have to come back to 1. So just to let you know that these phases and then these steps are not something that you should take as gospel, that like, we have to do it in this way. It's very flexible. It's meant to be flexible. It's meant to meet different communities where they're at and apply these steps to what capabilities are at different times. So there within these three different phases, the steps are identifying champions and a project manager. All of us in this room is a champion, as was pointed out. There are folks with political power that are also champions. There are folks that are super volunteers that are interested residents of the community that are champions. And champions break down barriers. They advance the agenda. They meet with people. They cheerlead. They talk. They're schmoozers. They talk people up. So I really am so enamored with that stage of getting a community to rally around the ideas. Assembling a cross-systems planning team. Congratulations, everybody. We're checking that off today. So we got one step in the books, right? Cross-systems planning team, we're going to go over what those different planning groups might look like. We'll talk about the objectives for that over this session, as well as over the course of these 2 days. Executing across data map, we are going to talk about data. Do not head for the exits. You do not have to know math. You don't have to learn how to code. You don't need, I'm not going to give you quizzes or homework, but I am going to show you some data, and I hope that you can hang with it and please ask questions. Creating a pipeline to supportive housing, just as Margaret had stated, getting what we would say is supportive housing out there, and then of course evaluating everything. So how well are we working? And that's there's a lot of leeway there. Through the data process, we'll discover more about the opportunities for referrals. So where are people coming from that are meeting our definition of use, that are meeting the definition of a frequent user? What are the different systems that we have to, how do we interact with the jail system or the emergency rooms to make sure that they're aware of these different, this project, to get them involved and included? And then, actually doing it. So actually housing people and being in the work day to day, monitoring for success, and then scaling. So great, let's do more. So in a nutshell, that's what Fuse is, going from idealistic to realistic to expansive. Okay, so who are frequent users? I'm going to move around a bit so I don't feel like the size of the room are getting that attention. Who are frequent users? I would say that the frequent users are at the pivot points of these systems here. So periods of institutional involvement, we can define the institution quite broadly if we need to. There's 3 circles here, but you could add 14 or 16, or it could just be 2. And it's important to recognize that we start where we can start and expand as we can expand. So just giving you that permission to do that and be flexible. So I just have 3 here. One of the I don't know what nuances of frequent users is that they often last what's called chronic status. So chronic homelessness is a HUD definition. It's defined by statute and regulation. And I won't go into specifics of it, but the main component is that one has to be considered chronic homeless, has to be on the street or in shelter for over a year cumulatively, or having a few episodes over a number of years. Often people that are cycling through systems will be in jail, or will be in hospital, or will be in psychiatric care or child welfare or any other number of systems, but not spending the majority of their time in homelessness, and so may not qualify and be considered chronic. And that becomes an issue when you get to the system resources, because many of the deep subsidies, permit support housing, rely on that eligibility criteria. And so the Fuse process, the benefit of it is that it removes this idea of chronicity and tries to overlay who's falling through the cracks, right? It's patching a pretty large crack in the system. And I should say that this is a nationwide issue. It's not just centered on this community, it's all over the place. And so we see this very typically. And then of course, Again, I just want to give you permission to be community focused and define for yourselves what does frequent use mean, what do your data look like, and you have complete control over the development of this project. So your input's very important. And just stop me if I come to the place where you're supposed to go. Okay. So when I look at data, there are like two main hypotheses that the fuse system will come into. So either we know that there's a lot of crossover. So if folks who work with people experiencing homelessness every day, you may notice that many of the people that you work with may go to jail, may go to emergency rooms. So you know that there's crossover. So we find that in communities, when we're doing our data analysis, people usually come into that with a hunch. I really think there's a lot of crossover in these systems. And the opposite of that, we get this less frequently, is that, we don't think that there's a whole lot of crossover. And in either event, what the data map will tell us is which one of these hypotheses is true. And then, or which ones do we suggest are true? And do additional analysis to figure out, what do we do about that? How do we proceed? But often flows from these two ideas. And just kind of show of hands, who thinks that there's a lot of crossover? Yeah, me too. That's usually the one I fall on. But the opposite could be true. Who thinks that there's probably not a lot of crossover? That's okay. I don't need to call anyone out. You can come up to me and disagree. Okay, so this is one of my favorite slides. So picture in your mind a time period of 2 years. And then picture one person over the course of these 2 years. This person goes into hospital 4 times. Two times in both. That same person gets booked in jail. A few times. Little, a lot, little more. And then that same person again experiences homelessness and is on the street in shelter. We can see the periods of say that we know that gets booked in this. But when we put it all together, and I just want to show you the power of the data sharing piece, is that we can start to construct these narratives about frequent use by scaling the experiences of individuals that are going through these systems and having systems fail them repeatedly. And so the white space in between the different involvement is unknown, and that's okay. We could fill in the gaps, probably with other systems, and sometimes we may never know. And the point isn't necessarily to fill in all the gaps, but it's to get as complete a picture as possible so we can understand the experiences of frequent users and then hopefully end that cycle of institutionalization. And then once it's set up, where can we stop this cycle? Maybe we can stop it once the person is put in jail and say, oh, you've experienced homelessness before. Maybe it's when they get into CPR. It's saying, are you at risk? What has your experience been? So it's really trying to change the narrative a little bit from individual systems to a complete network.
I love that slide because, right, it really talks about, it speaks to this work that we're hoping to embark on over the course of these next 2 days together, right? So why are we here, right? We're here to plan and prioritize about how a Fuse initiative really is going to be integrated into your overall approach to unsheltered homelessness and your homelessness response system, right? That really is sort of foundationally what we're hoping to sort of begin the conversations around today and tomorrow. But we also want to think about what are those benchmarks and timelines that we can really sort of set our minds to achieving over the next 3 to 6 months as we really think about launching this work together, right? So over the next couple of days, we're also going to be thinking about developing some next steps, some specific benchmarks, some milestones that we're really going to be looking for. We also want to think, we've got a lot of diversity in the room today, and I'm so pleased about that. But I also know that there are folks that we meet at these tables that may not be here today. So we want to also think about what is our plan for reaching out to folks who are really going to be necessary in this work, that may not be part of this 2-day planning, but that are folks who are really going to need their support as we think about, again, these practice changes, the things that we're talking about, you know, improving in our community, right, in order to better identify and serve folks and tell that bigger story. And then we're gonna think about how are we going to establish that, you know, again, to Liz's quote, right, that sustained working together. How are we going to do that? What are going to be our agendas and meeting schedules for continuing this work together? So when we think about Fuse, one of the sort of, you know, those core components that Ian mentioned earlier, when we're thinking about sort of this planning stage, right, we're going to need to sort of think about putting these various various groups together in order to help us identify sort of, you know, what are those things that we can, that cross systems planning group is really going to help us kind of move this work forward, right? They're really going to be that you know, keeping them informed as this work gets going. A smaller subset of that group is sort of that core steering work group, right? It's a smaller group of people who are like, okay, you know, this is the main group of like recommending decisions, moving the project forward. We've got a data work group, right? Because we know that we've got to have that health system data integration, that jail system data integration, homeless management information system data. We've got to be able to start to figure out how not only matching these data and understanding the scope and scale of what's going on in our community, but also ultimately, like, what is that process by which we would, again, as Ian mentioned, when we're telling that story, how are we identifying folks early on? And then as Liz again laid out, we've got to have those funding, those resources, right? We've got to figure out how are we aligning those resources, and we're going to talk about ways in which we might think about doing that. And then scaling and evaluation, right? We know ultimately we may start with 100, you know, a pilot of 100 folks. What does that look like moving forward? And how are we going to evaluate that with the help of our friends over at U of A? But right, like, how are we going to make sure that what we're doing, evaluating what's working, pivoting when it's not, right, making sure that we're doing that well. I'm gonna turn it back over to Ian to talk a little bit more about that.
Yeah. So again, like that cross systems planning team, the assembly of that, step 2, that's what we're doing here today. So this may be considered a Fuse kickoff meeting. You may have 7 or 10 other kickoff meetings in different spaces. You might consider the meetings that you go to. So, you know, lots of people from the community, lots of volunteers, lots of people from different sectors. I know I have a lot of meetings. I'm sure you guys do too. So at those meetings, consider, like, when it's appropriate or when it's germane to the conversation, talking about these and saying, oh, did you know that I went to this thing? There's this thing called Fuse. Don't know much about it. We talk a lot, but like, you can go to this website. Here you go. So like that, I think that's enough, right? I think that getting that conversation started in different circles and having those kickoff meetings. So what we find is that, again, just to continue with the theme, is that Liz brought forward, like, you're all champions here. And so it's our collective responsibility to bring the work forward, because who else is there? Right? It's us. So just in terms of getting people excited and the knock-on effects of, like, if every person talks to 2 other people, who talks to 2 other people, or talks to 2 other people, then we're really starting to build a team. We want to break, when we're talking about planning, we really want to break out of the scarcity mindset. Yes, resources are finite, but we shouldn't plan for that. We should plan for the optimal. And as we go through that, we can have a conversation about how to match what we have with what we can do. But as you're planning, you should always be planning for that optimal situation. And then we'll take it from there. Just rely on each other and the work groups to move the work forward. And then the second thing is, and I really can't stress this enough, is that it's a commitment. And I know we're all busy. We all have lots of meetings and a lot of work. what often can happen is that this work can feel like extra or more and be sidelined. And I would encourage us to just be committed to this work, because it is systems change, and oftentimes systems change gets put to the back burner, to the emergency or the email that you got today. But so I just want to recommend and admonish everyone that this is going to be, part of the work, part of the journey, and it is difficult, but also needed, and part of systems change is really tough. Okay, we're getting to a place where we're going to pause for a second, but before we do, given what you know now about Fuse, we're going to open it up on Slido. If it can't get working, we'll have a chance to raise our hands. But for now, what has interested you most about Fuse, and what do you want to know more about? So we're going to open it up. So far, what interests you most about Fuse? If you can't get working, but you have something in your head, go ahead and read it.
I like the aspect that you guys are bringing in all three of the programs, like being in the healthcare system, being through the legal system, and then being through the actual homelessness itself. I think a lot of people in the community don't realize that all three of them effectively all tie into part of themselves. So the fact that you guys are presenting that as part of the data and it's something that people can literally see. So I like that you guys incorporate that in, because I think a lot of people don't consider that. Like when they think about how much they just think about someone not being on it. Yeah, they don't bring in all those other possibilities that could get them that out. Yeah. Give it off.
Fabulous, thank you.
I love these too. Thank you for the folks who are putting things in, right? This one especially to me is like the most important, because I think often when I've when I've seen folks who are they've had 10 bookings in a year and they're using the emergency room. I did a Fuse, this was actually before I joined PSH. There was a Fuse initiative in my community that I was a part of. And well, Liz, you may remember this. We had a gentleman who had been into the emergency room 285 times. 285 times in a year. And that Fuse initiative started by just going to the emergency room and asking the ER docs, like, give me they literally just wrote their names down of the guys, of the folks that they were seeing the most, who they knew didn't have a home, were basically using the emergency room as a shelter. So this gentleman, 285 times, never known to the homeless response system. Never, I think he had one day in HMIS, and that was because the police dropped him off at our downtown campus, right? So can you imagine if, like, this person will never be prioritized through your coordinated entry system? This person will never rise to the top of your homeless response system and any of the resources there, because he's using the emergency room. Well, does the emergency room have housing choice vouchers that they can deploy? No, right? So this guy is just flipping through the cracks over and over and over again. And what else is happening? He's costing our community. Again, can you imagine the cost of 285 visits to the emergency room in a year? Right? So now this guy, we find out he's got a traumatic brain injury. He gets housed. Now what is he doing? He's thriving in his apartment. He's still housed, at least the last that I heard, which wasn't that long ago. He's still housed. He's got a part-time job. Doing great. When's the last time he used an emergency room? No. All right, so these are the kinds of lives that can be changed and impacted. So yes, it's a cost savings approach, but really it's a person. We're talking about lives of people. Yes.
Yes, I represent the One Love Street Garden Club, and our goal is to provide water to the homeless. Significantly bless the aspect, but also could impact the judicial as well as the healthcare system. Because currently, as you know, I'm sure the city of Tucson is greatly reduced access to healthy water. In Tucson in particular, with our weather, dehydration and heat stroke and related symptoms are usually accompanied with delirium and confusion. Now, when the Tucson Police Department or various other law enforcement agencies encounter people who are dehydrated and delirious from this condition, they often think that this person is a danger because he's unable to communicate properly. However, it's not because he's tripping on drugs necessarily or drunk. It may be because he's been in the sun without water for hours and hours at a time. This also causes necessary emergency services. And when I have offered water to people who are homeless and being questioned by police, oftentimes for long periods, it has been refused, and they do not offer water or any sort of care to help the person regain some sense of mental stability in order to properly answer those questions. So you can see here on the phone.
Sure, yeah,
And so our focus here is really to address not just shelter, but the public health emergency we have going on here with the dehydration and then the confusion about mental health issues that oftentimes can be confused with dehydration.
Yeah.
So I encourage you to food, water, maybe food.
Yeah,
There, in your community program, and also at the city of Tucson to address the public restroom and other issues regarding water.
yeah, certainly those are all things we wanna bring to the table, as we think about the solutions. And we definitely are really focused on, what are those solutions that we can bring to the table. So thank you for sharing that.
And then also, what else do you want to know more about? So duly noted, we'll definitely, we're recording it, taking notes.
Yep.
And then all of the solutions that you have here, we're able to export and save. So just know that like feedback that you provide is going to be saved and reviewed, so that we can save all of those great insights for these 2 days, to make sure that like we get as a broader perspective as possible. We don't miss things that haven't been talked about. With that, what do you want to know more about? So based on what we talked about, what are you interested in learning more about? And if you already said in the previous question, that's fine. And if you have something as well that you would rather raise your hand, you can do so now as well.
Crossover of all three systems, that's a great one. Oh, these are all so good. These are all so good.
First responders, the action committee, transportation. Great question.
Great questions. Yeah, these are great. These are great. On the ending chronic homelessness piece, I want to just kind of go back to Ian's definition about how folks that may be high priorities and meet the FUSE eligibility criteria may not always meet the HUD definition of chronic homelessness, right? So I think that's sort of a yes and question, right? We're gonna be working with TPCH over the next couple of days to kind of think through some of these strategies. Right, but I think often there are folks who would be FUSE, who would think, of course, we need to prioritize these folks, they're incredibly vulnerable, but if they don't meet the definition of HUD's definition of chronic, are we not going to provide resources for the people? Those are the questions we want to be thinking about. So it's a yes and from my perspective, both and.
FUSE, yeah, definitely and in FUSE, when we come into communities, we're not seeking to replace anything. We're seeking to add. So this doesn't take away or move around or transfer any existing resources. What we're talking about is really want to add resources. So just keep that in mind too.
That's a great point. These are all really wonderful, wonderful, and keep them coming. Oh, yes. No, you're fine.
Most of the internal delivery address, the address, like, there's also in the 702 South Sixth Avenue, which is, the part of corporate address, because it's difficult with getting the system cell phones and things like that. But it's, that's a good manner of outreach to, approach folks perhaps that, use, non-traditional address, that indicates, homelessness and such. Toward entry into the.
Yeah, 100%. That's definitely going to be part of the approach, right? So,
Especially with data collection, when in like services, like I'm not familiar with all the acronyms here, but in my community, we call the Department of Public Social Services, the people that handle Medicaid, TANF, food, the SNAP, those are like county services in my community, and oftentimes they and other people working on homelessness will use those general addresses that people have mail sent to those main offices, just as I think you're describing as well. And that's used sort of as a proxy measure for like, are you probably experiencing homelessness? So yeah, it's definitely important for the homeless piece for sure. Great question.
and I also think for the outreach piece, right? So to your point, both. Yeah. Thank you for that. That's really important.
Great. So should we take a break?
Yeah, I think we'll take a 10-minute break. Give everyone a little bit of time and come back and get back to
Yeah, 10:25 please. Different use communities have done data matching differently, and that's okay. Again, we talk about where we're at, what capabilities we have, what technological approaches we are able to utilize. And so sometimes it's a one-time match. Often that's where it starts. So a point in time pull of data, big or small, depending on the system and the parameters of the data. But we take a set from the justice law system, from the homeless response system, healthcare system, from child welfare, wherever, pull it all together one time. It's not real time, so we don't know if someone comes in today or tomorrow, or the next day, whatever, but like we have historic information. And that is usually where we start the process. And spoiler alert, that's where we're starting the process here at a one-time match. As Fuse is established, or as there's capacity in the community, there are other approaches to matching data, repeated data matching, which becomes more real time. Maybe it happens on a monthly basis or a weekly basis or a quarterly basis, or depending on the capacity of everyone, the data is rematched together. So it's that sort of one-time match plus where you're able to do that over the course of time and understand more trending. Systems integration, which is the combination of different systems. Case conferencing is a way of systems integration between organizations participating in case conferencing, the coming together of people. But in a data sense, like, oh, do you know Joe Smith? Yeah, I know Joe Smith. He's, X, Y, and Z. And oh, can we do this? Can we do that? And you can kind of work it out between different systems. And then the last one is the real-time multi-stage data exchange, which is a more technologically robust approach where you have like servers and, web-based things and all the sort of buzzwords that you can think of where data are actually merged in real time in a warehouse or data lake or exchange or whatever. And I show these things not to say like one is better than the other, but I show them to say that these are the options. And also as a community and as the data subgroup have to come to some decisions around what do we want? What's our goal? And it's not to say that everyone should aim for the data exchange. Communities across the country know about it, skip it. And that's okay. So you, again, have discretion to say, oh yeah, in our community, a data exchange will work for us. Let's drive toward that.
Ian, can I jump in for
Yeah,
1
sure.
second though? Because I do want to say something about this real-time multi-system data exchange. It's very exciting in Arizona, which is that all three of our continual of care, our state Medicaid agency access, they are all driving for this right now. We have a vendor selected that for the purpose of care coordination, right? To better understand not only who are those folks in our community that are hitting these multiple systems, right? So we're a ways away from having all of that done, but significant progress has been made. So this is actually happening in our state. Arizona is really leading here, and the contributions from Tucson and Pima County are critical to making that happen. So just wanted to put that out there.
Thank you for that. It's very exciting work and great that like in this community, you don't have to worry about building something from the ground up. It's really coming from the top down, from all across the state, which is really, really exciting. So, yeah, go ahead.
We have to mention HMIS system is already in place within like in the house, because this is in the housing dynamic part of it. Yeah, and then it would still be in comfort.
Yeah, so basically what's happening in Arizona is there's basically 3 HMIS systems in Arizona across the state. And all 3 of those have made some commitments to contribute their data to this data warehouse. And Access, our state Medicaid agency, is also working on how data would be contributed. So there's really some, again, it's very early stages, but this work is happening. Pima County and Tucson are a huge part of it, right? It can't happen without you all. So this is just, it's all something that is in the early stages, but will definitely lead to better care coordination for folks so that you can sort of see that. But it's exactly right. Yeah.
And of course, the benefits of it are that it's interoperable. So as people are interested in it, they can join it. So it's going to be a platform that can that can be additive. So as new systems are identified, as new data sets are identified, the idea is that they can jump in and be part of the ecosystem as well. And so I just want to give you a brief rundown about the work that's going on as we speak. Like this morning, it'll happen later this evening because I'm working on it very actively, where we're doing, we've met with the HMIS committee, the TPCH board, and had some wonderful meetings around the kinds of data from HMIS, and we'll define all these terms, so don't worry, from the homeless response system data. So we have an extract of HMIS data that we're able to identify and show you some initial observations about them today. And just want to shout out to our Pima County colleagues for you guys over there. Bye. Thanks so much for all and everyone else who was able to help in getting that data request over the line and getting us HMIS system data. Really wonderful work and collaborative work. So the next step is we're working with other colleagues from the Pima County Jail and also Tucson Police to get those data. The next step is to match those together and then come up with some insights as to like how how those systems are functioning and perhaps failing people that are going through them multiple times. Hopefully in the future we can identify processes that can automate some of these data matching and analysis so that it becomes much more second nature. It's always, you know, a struggle. It's like it's really like a steam engine train, like chug, 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 but then once you get going, you starting to build in automation, it can be really, really quick. So just quickly what we're sharing. So for matching purposes, we absolutely have identifiers. So names, dates of birth, social security numbers to identify people across different systems. The data are shared under agreements, data use agreements. They're shared securely, they're stored securely, and they're never shown with those identifiers there. We also collect information regarding demographics. We talked about equity, and we'll continue talking about equity today and through the next 2 days. It's important and required for us to look at systems data with demographics, and it starts with at least these different components. And then on the utilization side, so okay, we have jail data, we have HMIS data. What do we want to know about that? Or we have hospital data. What do we want to know? We want to know about jail bookings and release dates. We want to know about emergency department visits. We want to know about someone said emergency transport earlier, emergency services. That's something that should be included as well. Shelter stays, outreach, all of it, as much as we can for as many people as we can. And then this is more background because we are starting with this one-time match. But oftentimes for many communities, you want to start quicker. And so there's something that we call list approach, which for systems that maybe you can't get full access to. So a hospital maybe be like, no, I'm not going to give you all my data. What a intermediate step would be is to say, okay, hospital, don't give us all of the data for everyone that's going through your emergency room. Just give us your top 10 people that come through. Give us your top 100 or 50 or whatever it is, but just give us the information related to the people that you see the most, or the people that you know also have housing instability. Oftentimes systems won't ask about conditions of other systems. So jails maybe won't ask you about health conditions. Maybe they will. Maybe they won't ask you about housing stability or your housing situation. Maybe they will. Homeless response system does collect on a number of those things, but it's all self-reported. And so it's difficult without the data match. And you'll see that in a minute when I show some of the data. It's difficult to see across systems just looking at one, right? Okay. So coming back to the slide, but just putting a different lens on it, who are frequent users? From a data perspective, we talk about wanting to quantify different things. How many records between the different systems are matched up? What's the cost associated with the utilization of the different systems? So this might come later, but that's okay. So, you know, how much does it cost per ER visit? How much does it cost per booking in jail? How much does it cost per shelter stay? And that can help as a narrative component when you get to the evaluation piece. You look at how much does it cost for the systems to do nothing versus how much does it cost when we are able to integrate, because it's not, it really is, the cost of doing nothing isn't zero here. And I don't have those data, I don't have those facts, but I can, that would be my guess, is that it doesn't cost nothing to do nothing. And so we really want to see from an evaluation standpoint, this is how Qs can build that case, is what does it cost now? What does it cost in the future? And we can get into all the ways to evaluate that as well, not right now. And so the first step, once you have this one-time match, is analyzing the match. This is an example from another community of a quick dashboard that I built based on data that were joined from Medicaid, from the jail system, and then also from homelessness, from their HMIS. The community, like your community has a data lake that they're able to pull in information from all these different systems, and at a state level, they're joined together. It's really, really amazing, fantastic state partners. And so they're able to give me data that was really, really nice. And they want to know a few things. They want to know, they want to know about disability. So did the person have a disability as identified in one of the systems that they were collecting on? Did the person have a behavioral health diagnosis? So as a community, they determined, we want to know about those two things. We want to know about disability, and we want to know about behavioral health specifically. You might decide something different, you might decide something similar, and that's okay. I'm just letting you know that that's something that they chose to do. And then as I put the data together, they looked at systems, we looked at system involvement, whether they were participating in the health system only, had crossover in health system and health, jail and health, all three, jail, homelessness, and health. And you can see how the population grows smaller as you include more systems, which seems natural, right? So you start big, and then you go down and have a smaller population that you can work with. One of the determining factors, one of the questions for them is, okay, those 63, is that enough for us? Is that our population? Is that the fused population? They had some additional questions around costing and around utilization, but just from synthesizing all this data, they came down to 63. Is it 63 people, the number of people that crossed over between jail, homelessness, and health? So they went through all three systems, and they came down to that number, and they wondered, is that what we're going to go with for our Qs? And so just another real world example. Okay, we'll turn over to Margaret. Yeah, I can keep going either way. Okay. So in Philadelphia, they have a fuse project they called it High Five, looking at the top 5%. And so they had a fuse champion and a manager. So the city of Philadelphia had a Department of Behavioral Health that was their lead in it. They came into the project with housing resources. So it's a little novel. Sometimes Fuse won't have housing resources outlined at the outset. That's okay. They did. So they came to the table saying, we've got a number of housing resources, we want to put them to use. And so they said, okay, let's do Fuse. They determined a target population. They had a number of different partners. And how they did that is they looked across their different systems. And so they started with the number of people who were, this is the justice system. They looked at the number of people that were incarcerated 2 or more times between a set period. And then they looked at the top 20% of incarcerations. And then they looked at folks that were incarcerated, but also had a history of homelessness. And so from this 21,000 people down to 5,200, then they looked from that 5,200 to see, okay, who's getting who was in the justice system in jail and also in homelessness received 20%, the top 20% of homeless services. And so they came up with this 1066 number. They combined the 1066 number of that crossover homeless population with the top 20% of incarcerations and applied a match to see who is between those. and they came up with, and then from that match, they looked again at the top 20% of service utilizers and came up with a number of 328. They kept going. So then they looked to see who had a history of service within the behavioral health system. And they went from 328 to 313. And then the last step that they had is who had a diagnosis of severe mental illness. And the number went from 313 to 220. So it's this like refining of the data and identifying of conditions and parameters of what frequent use is in their community. It may look different in yours, I'm positive, but the process may very well be similar, where you look at all of the data and you're able to synthesize it going from 21,000 records or so. They took 21,000 records and distilled it to 243. And in their community, they had, I don't know how many vouchers, but they were able to say, all right, that's our fuse population. Let's go find them. And that was in essence sort of, you know, in a nutshell, what happened. Okay. So we'll look at some data in your community. And so I just want to frame this up a little bit. It's so just hopefully the two previous examples sets up what we're talking about is that we want to make a determination about the severe service need, or what that population looks like, what are the hallmarks of that, what are the data sources that we need to look at, what's missing, and other considerations. So that's the process here. Do you have a question? I'm sorry.
No, with all this data accumulated,
Yeah.
you don't need to go find it. You already have it in the system, you know it. So why not use the system together? So if somebody's got some mental health issues, why don't you have mental health subjects in what jail? Put them through that, and then down the line, eventually get them into a homeless program.
Yeah.
I mean, instead of having to go find them, I mean, you already have all the information right there.
That's right.
All these systems need to come together, work together a little bit more instead of, oh, my job's done. You know, send them on the street and hopefully they'll go find some more.
That's exactly right.
I mean, you gotta work together.
Yeah, exactly right. Did everyone hear that?
You basically just described what we're trying to do, because right now, you know as well as we do, that
They need to work
we don't,
together. I mean, yeah,
right?
exactly.
Right. Right.
Excellent. Excellent point.
But that's
Absolutely.
exactly, I mean, if we're just foundationally saying, what are we doing here? What are we trying to accomplish? You just outlined it.
Everybody's saying it's not my job, not my job, but no, if you want to, you gotta come together, and have a community come together, you have to do it there. All through it.
Excellent. Exactly right. Yeah. And so we know what we need to do. And so how do we get there? How do we get to, you know, we all have to work together. We need to merge the systems together. And also letting other systems know of the people that one might be working with. So like, yeah, I'm working with someone who may need behavioral health services. So how do I make sure that information about that person makes it to that system, and then there is a link. And so Fuse helps through a lot of work and a lot of effort, helps to bring those data together and also bring those systems together much closer, so that collaboration can be easier.
On the street at 3 o'clock in the morning, we have to jail. We're not gonna go find that other system, we're gonna go do what we do with homeless people, you know, I mean, more often than not, we're not gonna see that next step.
Yeah.
You know, we're gonna be lost in what we do all the time, and then back and go.
Yeah, excellent point. Thank you very much. Sorry. So a few other things. So again, the objective of showing these data is to match them across different systems. They're not matched quite yet. So there's a lot of additional insight that is still forthcoming. It's iterative, so just want to let you know, and that means it's going to change, very likely. And that's okay. We are going to learn things. We get new insights. People participate. That's the nature of it. And so we want to make sure that we just set it up that when they change, no one's surprised or shocked or thinks it's bad. It really is a good thing. We get more detail. We get closer to a solution. So I'm going to go through some of the I described them as headlines of the different data sets that I've looked at, and I've looked at a number of them. So the first one is, we'll start with the point in time. The point in time count, or we call it lovingly the PIC count, in HUD world, is something that happens and typically annually. Sometimes communities do it more often, sometimes communities do it less often. But it's typically done annually across the country. It's typically done in January when there's not a global pandemic happening. And so it happened a little later in many communities across the country, and that's okay too. And so, yeah, go ahead.
Can we back up a second?
Sure.
And I just want to clarify. Now, people who will be involved in the program will have to share their mental health information with the state, is that correct?
In different cases, it's voluntary. So data collection with.
Do you think that will affect the response numbers we will get?
Often, I'm sure, but you know, you kind of work through, there's releases of information, there is, you know, informed consent, and so people are allowed to self-disclose or not.
Like a lot of people in our community may not be so interested in doing that.
Yeah, well, that's something, you know, I really can't speak to, but I appreciate the insight for sure, and that's definitely something to be considering, especially when it comes to data quality. So I actually want to hold on to that thought if you don't mind. We'll talk about that a little later. So the point in time count, has anyone volunteered for the PIT count in the past? I know I have in my community. It's a really interesting experience. I find it very nice to participate every year. And so the point in time, people will, the typical way it works is that people will fan out across the community and are able to tally different households together. And so what we saw in 2022 in Pima County for the PIT count was, and I think Liz described it earlier as well, around sheltered, unsheltered homelessness, the number of people, the number of households. I have it broken down by age range, and then I also include the idea of chronic homelessness, the thing that I talked about earlier in the presentation. And so chronic homelessness, again, has a very specific definition. It's length of time on the street or in shelter. There's a disabling condition that's attached to it normally. So physical, mental health, substance use, HIV/AIDS, behavioral health are all considered are examples of disabilities that would qualify. And then I think that's kind of it. Those are like the main contributors for around chronic homelessness. But I show this to say, is this where we start? And there's a question, not a statement. Is this where we start? Not end, but is this where we start when we talk about severe service need, about frequent use? Maybe. I don't know. That's an open question. Don't have to answer it right now, but I just am framing some of this stuff up. The PIC count accounted for additional populations. So there's a demographic survey. Yeah. I'm so sorry. I can't quite. Let me get closer. I'm sorry. Sure. Yeah.
Without anyone else having to talk to the court.
Yeah.
While I was at the same time, I also disclosed that I kind of help them as, you know, part of the institution to receive that. People were just like, well, how to get out of it. It means, you know, afterwards, it's full of that led to a lot of focus. Not necessarily at the university.
Yeah.
People would like literally call the cops on it if they saw them.
Sorry about
I was holding the question for 2012, and when I read, and like, I was in cops around my house. You know, like, all of them.
Yeah.
You know, basically more like,
Yeah.
you know, like, in terms of and not the cops were there because we don't have to get people, but when you can play, you know, like,
yeah.
and this is a number of years ago, but still understanding like the people's point.
Yeah.
This is from community work. So I can see how like any number of people in opportunity,
Yeah.
and all that would be very complicated, especially knowing as it's happening to you.
Yeah. Yeah.
And like the entire building is supposed to be something happen. And whatever they do about like, you know, that,
Sure.
they all try to happen and they all like that.
Yeah.
But everyone is
Yeah.
they're all not serious.
I'm-
Not gotten, but
Yeah, I'm sorry about that situation. Thank you for bringing it forward. I think that there are serious ethical concerns about data collection.
Yeah.
And when data are collected, it's the responsibilities of the systems and the people that are collecting them and analyzing them and observing them and using them for whatever purpose, that purpose is specifically defined and that no more data are shared than is necessary with the number of people for whom it's necessary for. So it's not that, and that should be values that are established as part of this youth program. I think the data work group should definitely will have an opportunity to key in on those concerns that are like specific to your example. But I'm confident that that other people may experience that as well. And so defining how data are collected, making sure that there is disclosure and people for whom data are collected have agency about what they share and how it's used, and is definitely part of the conversation as you build out a Fuse program. And so those are very serious concerns, and encourage everyone to be mindful of them. We will certainly discuss them. It's definitely part of the agenda of the data working group. People will have an opportunity to weigh in. And also systems are capped, like that, the experiences that were expressed already, like those things have happened. And so how then can Fuse be a platform for systems change to adjust where things need to be adjusted for data collection, for data use, and make sure that as those decisions are made, the people who are impacted by that data collection are considered included in them to make sure that it is comparable. I firmly believe that if data sharing is used, if there's proper consent, if there's disclosure, and if people have agency, that data sharing can be used as a way, as a trauma-informed tool, and to not have folks repeat their stories over and over again. And that if a health center, for example, this is the one health center I'm thinking of as a specific example, as a health center who has a food bank, and there's someone who the example that I've made up was that what if someone had a diagnosis but wasn't really comfortable talking about their diagnosis with other people? Well, the health center could send that diagnosis to the food bank and say, you know, this person has diabetes, so just make sure as you're giving them an allocation of food that you're mindful of what they can eat, what they can't eat, whatever. That's not to say that you send that diagnosis so with everything else about that patient. You know, the food bank doesn't need to know about their social security number. They don't need to know about their name. They don't need to know about their blood. Well, maybe the name, but not like their blood type. They don't have to know about like, you know, where they were last week or where they're going tomorrow. They don't need to know about their appointments. And so in microcosm, it's important when we're setting up data collection and data sharing to, and I put it up early and I'm sorry that I didn't focus on it, but to establish by agreement, by written documentation, what you can share, what you can't share, to whom, for what, and what are the consequences if you disclose, if you break that agreement. That's a break in policy, if not law in some cases, and so it can be quite serious. So yeah, much of it is common sense, and also being empathetic. And that oftentimes when we think of data, we don't think of empathy, but I think they should go hand in hand because and something that I'm reminded of all the time working with data is that the numbers that you see here are representative of people's lives and are important. And so we have to kind of we are responsible. I'm, as an analyst, responsible for the story and interpretation of these numbers, and so it's important to be as accurate and also as respectful as possible. So I thank everyone for sharing their experiences. I hope that I'm sorry for kind of diverting a little bit from the conversation, but I think it's important to have. So thank you very much for sharing. I hope you continue to bring them forward. Did that help?
I think it's also because it's important to understand that despite what we believe
Yeah.
it's important to understand that we don't need to live someone's story to know what we feel sometimes.
Yeah.
Or let it explain by someone else.
Exactly right.
And also at the same time, we don't have to exploitalize on it.
Yeah.
And we don't have to let it out.
Yeah.
Because that's not our job.
Right.
It's not the process.
Precisely right. Yeah. So yeah, inappropriate disclosure is inappropriate and maybe even illegal. And that's something that needs to be stipulated to before anything is collected, let alone used and analyzed and shared. So thank you again for those insights. Please keep them coming.
And I want to think about
Yeah.
the work process.
I'm sorry.
I want to think about the work process.
Yeah. So I'm very sorry that you had an experience, certainly inappropriate, and definitely something that shouldn't happen.
So the burden is still, I mean, we're all like social film, the burden is still.
Yeah. Yeah. Yeah.
I was still with the university.
Yeah.
So I was like, I'm not cool.
Yeah.
Maybe I'm a topic around concerns around data privacy.
Yeah.
I see a lot of work in this being done to narrow down to the top 200 people. I wonder if the program were a little bit bigger, if actually less study might have to happen, and less data sharing might have to happen. If each of those agencies could say like, okay, these are the people who are coming into the hospital all the time.
Yeah.
We may not have to share it all around if we have the tools that we need, and maybe that means having several hundred more, maybe it means 600 rather than 300. But those 600 people all need that place too. So maybe less focus on trying to get just the top,
Yep.
and the amount of resource that goes into that research,
Yep.
And empowering these agencies that are already seeing people to be able to channel people into that. I would like to see when you're doing these cost analyses of that being factored into, because it does seem like a lot of cost into just finding out who those top users are.
Yeah, absolutely. I think that's a great point. What I would add to that is like, we certainly don't want to place limits on it, and we start kind of with the top or near the top, just based on views, but it's really meant to be a platform for that systems change exactly as you described, to expand that definition. I understand what you're saying about the prioritization and the analysis. In my experience, that analysis, like the work and the cost that goes into that, is sometimes is quite outweighed by the cost of the system of the frequent users that are like engaging those systems at an intense rate. And so what is generally, I wouldn't say all the time, but most of the time, in many occasions that I've seen personally, is that the top 20 or so % will take up, a lot more resources proportionally than the rest of the population as well. So I understand exactly where you're going from, and I agree with you. And I think Hughes can be a stepping stone into that systems change to widen the net. Yeah, quickly, and I just want to keep going.
Yeah, so I just want a clarification. The example you gave with Philly, this is kind of based on their question. Is that 20%? Is that an arbitrary number? Is that
Completely defined by that.
okay? But I mean, is there any particular reason that they chose 20 as opposed to 25 or 50
They
or
may have,
any other number?
it could have been a dartboard. They could have pulled a number of a hat. Like, it really was rather arbitrary. Like, it wasn't. I don't know that they had like a scientific, 20% sounded good.
But in the end, they got the 243
Yep.
people, those folks got housing first vouchers.
They were identified for that, and then the work then was to, okay,
So they had to come up with a number that they could present to HUD that would then,
present to work for themselves. It wasn't HUD dollars
okay,
that were used, it was the dollars that they had. I think it was a state behavioral health fund, but they had a kind of a set amount of funding, and so they had to figure out who can we fit in this funding.
so that's what, so the,
Yeah.
the funding, right,
Yeah, it was a conversation between funding and then also the population. So like, but they didn't limit themselves in terms, the numbers were gonna shake out how they were gonna shake out. And so you shouldn't, when you're, this is a great point, thank you for bringing it up. The funding shouldn't determine the number of people. You should determine your population first. You should know who you wanna serve first, and then go after the funding that you need to serve that population. So it's a conversation when you're talking about views, how many can you work with, whatever, it shook out for them, great. But you need to define your population first, and you don't have to worry about, shouldn't worry about funding until it's appropriate to worry about funding. Great point. Okay, cool. So if you have questions, I definitely encourage you to put them in Slido. We'll get to them. And thanks for all the input as well. Oh, so actually you get a chance on the Slido in a minute. So HMIS stands for the Homeless Management Information System for those who didn't know the acronym. I've said it a lot. So the data, it's a data system that's required from HUD. There are many vendors that produce this kind of software. You just have to, communities can pick one. There's standards that they have to follow. Communities have flexibility to add different questions, to modify different questions. Can't change questions that are required from HUD. Data are collected in real time all the time. It could be happening right this second certainly across the country, certainly in this community. For the data that you're going to see in just a second, the HMIS data in these analysis we're looking at households that are engaged at the time the data were pulled. So if you had an open record, if you're currently that night or whatever in shelter or in a rapid housing program or what have you, that data were included, or those data were included. And then also any household that was entering or exiting programs between January and June. So that's the time frame that we're working with. There's a caution here that I want to put on this right now, which is that there's a difference between point in time and annual counts. So point in time happens, 1 point. So you have in January 4 people, 1, 2, 4. In July you had 6, and in December you had 3. So quick quiz. Sorry, I said there wouldn't be a quiz, but there is a quiz. What is the annual count here? And you'll get a chance to put it in Slido in just a second, but just take a couple seconds to look. There's no consequence for getting it right or wrong. All right, I'll open the Slido and come back to this in just a second. So what's the annual count? Okay, it should be open. All right. Okay. All right. Okay. So what's the annual count? It's C. The answer is 8. So you have, if you count the colors of all the figures here, blue, green, gray, orange, purple, yellow, red, or burnt orange, depending on your Crayola fan, and then this other sort of violet color. So sorry if you couldn't quite see the difference between the two. It's a little clearer on the screen, like on a computer screen. But it's 8 because you count, orange guy is orange guy, blue is blue, the gray figure here, and that's counted once across the entire year, rather than at a point in time, right? So just when you see information presented as a point in time versus an annual count, there's a difference. And it's important because you can't necessarily compare the two, but I'm going to. And so when we look at the HMIS and take comparisons, just that point around annual counts versus point in time is really, really important. That said, the PIT was conducted in February 2022. what could the differences tell us about the length of time of homelessness in the community? Maybe a lot, maybe not much. It sort of depends. There's a number of points of view. The important parts here brought up already: who's not touching the response system, and how data matching could help with telling that story, combining different systems together. What else do we need? And then there's more data, with more analysis, with more perspectives that are still needed for sure. But my take on it, just personally, when I see the point in time at 1856 for households, and then HMIS at 2553, like, we know that there are many people that are included in the PIT that aren't going to touch the HMIS. We know that some folks in HMIS may not have been counted in the PIT. But just like generally, rule of thumb, without too much additional scientific analysis, I would see this number as, okay, this was a late February 2022 number, and then this is a July-ish number. So the length of time that people are remaining in homelessness is not a short time, but it's also not a very, very long time either. So there's more analysis that can be done about specifically the length of time that people may experience homelessness. But it's sort of like in between. From my point of view, other people can differ, and that's totally fine. Yes.
I'm curious about how other communities, like, by and large, have felt about their PIT. Because I'm kind of a data geek, you know, and data needs to be, nerd and stuff. But I remember the first, like, couple of years that I was homeless and stuff like that, looking, so I was just curious about it.
Yeah.
You know, I was in the PIT town, I believe, twice of the various years that I was homeless and such. And, I was just kind of aghast a little bit.
Yeah.
That so few women were counted, you know, and stuff in the given years that I was in it. And I was like, how can that? I personally know it.
For sure.
Yeah. You know,
Yeah.
so I was a little disturbed by the anemia of
Yeah.
counts and bugs.
For sure.
And, if that's kind of a regular problem, and if there's in some places, like I know now, I've known this for a couple of years now, you know, that it's the last weekend in January, and such like that. But I feel like there's not very much, if I hadn't been well connected, and I had to really hunt down to be in the account the second time,
Yeah.
you know, and such like that. Just if other folks have had a similar experience as a PIT count, or, well, how the data feels about that. You know.
Fabulous segue. So we're going to do a temperature. I'm going to answer your question. I just want to get this going right now. So on the slide out, and you can certainly raise your hand if you feel strongly about it as well. But we wanted to get your pulse. So we showed you some data for temperature, whatever metaphor I use. But just go ahead and select whatever you're feeling. In terms of the PIT count, my experience working in other communities, certainly in my community, it's Los Angeles, very big. We do the count. It's enormous. We do it over the course of 3 nights. Everyone has an opinion on it. Some people, there are communities and people in those communities that have multiple differing opinions, but oftentimes there's a general consensus that, like, you know, we're this community and the PIT is gospel. It is ironclad, and there are people in those communities that disagree very strongly. And then there are some communities that do the PIT and they say this is just something we have to do for HUD, but it really doesn't mean much to us, and we don't really use it for much, and yeah, we do it here or there, whatever. And then there are communities that are kind of in between that have like, we use it for these things and those things, and are a little more nuanced about it. And I find that that's a good place to be. It's good to have questions. It's good to want to improve and look at the methodology and say, are we doing this better? Are we, you know, where can we improve? What is it used for? Are we collecting on people, engaging with people who are experiencing homelessness to make sure that, like, the areas which are prevalent or common are counted? So like there's a lot of nuance there. So I hope that answers your question. But it sort of depends. It looks like people are in that space too. Yeah,
I have a question about clarifying that HMIS data. Was that with the HMIS something fine? Or is it like the annual count of how many people use it over the course of the year?
yeah, good question. So for HMIS, the data are pulled, on a day, but they are pulled for a window of time.
So we work with your HMIS lead agency and TPCH, who, right, is essentially responsible for those data, your continuum of care. So they actually pulled those data for the purposes of this. So we were able to kind of look at not only the point in time which TPCH publishes, but also this time period. So that's sort of what we're talking about. So those actually did come directly from your homeless management information system lead, which is Pima County. Does that answer your question? But do we know what the time window was?
Yeah. It was, I believe, January 2022 through June of 2022. And so that would be anyone who had activity in that period. So it could be people that entered years ago, but still have an open record, or people who, came into the system within that window, or people that were already in that in the system and exited. Yeah. Great. Okay, great, excellent. Thank you so much for participating. Love the spread. I still have questions too, so that's a very natural place to be. And really, thank you for the candid feedback. Okay, so we're gonna pause a little bit for questions and just take some that were already put in here. Oh, great, people voted. I'm so stoked. So I do not see rent control and CSH policy priorities.
I'd like to address this first one if I could. So CSH has actually been hired by TPCH. So CSH is providing us, as I mentioned when I sort of outlined what CSH does, we're supporting this process through technical assistance, but we actually don't have policy priorities related to this necessarily specific to the city of Tucson or Pima County. So that this work really will be led by TPCH in the city of Tucson, right? Along with all of the other partners in the community. But I just wanted to clarify that this work, so these are really critical conversations that the community is going to need to have. But as far as CSH, that's not what we've been brought in to do, and that's not something that we have weighed in on. I just want to clarify that. And just sort of clarify what CSH's role is in this process, right? We're really providing that technical assistance, that guidance, as you all dive into this work and supporting that. But these are going to be in critical conversations that you all have with each other as we move forward with this work. So this is a really important one, right? The folks that are entering into homelessness when they exit jail or prison, right? This is something that we've talked about throughout. This is something that we're certainly really thinking critically about, right? How do we engage folks in ways that are meaningful at release, and how do we identify them, right? To the point earlier, we're talking about helping systems work together more effectively, right? To serve people more effectively and meet those needs. So this is an important point about resources, right? That's really good. Yes, we can get copies of slides for today, and I think this is being recorded, so we'll have those out for you. All Fuse work groups should include people with lived experience. These are really great questions, and we can kind of go through these.
I saw one about domestic violence, and that's definitely something that we'll consider. Absolutely, it's part of how HISE is also defining severe service needs.
So the city has already put in their housing first approach and using VIs for that. These are certainly conversations that we're going to be having. Although I will say, it's sort of like, as we've been talking about, we're talking about more than, right? So we're not talking about one program, we're talking about how do we get programs to work together more effectively. Lots of great questions here that we're gonna get answers to.
Great. So, if you wouldn't mind, we'll break for like 5 minutes, please, just so that we can get back on timing. Great. So we'll break for 5 minutes. If you have questions, please come up and we're happy to chat. Yeah. Still working, right? You got it?
Oh, wait.
That's you? Okay.
All right. Wrap up in 30 minutes, so we're appreciate all of your patience and contributions so far. But this slide and the next couple of slides really kind of reflect some of the objectives that we've been talking about, some of the themes that we've been talking about today, which is right, our current system, we've got all these silos, programs are you know, working independently of one another, right? So if I'm a person and I need housing resources and I need other services, I may touch all of these, but I may have to, like, you know, it's not, these aren't coordinating to help serve me more effectively, right? So to the point that was made earlier, if I'm in jail, but we know that what I really need is a behavioral health service, why can't the behavioral health service come grab me from the jail, right? So we've got all these uncoordinated systems and they're not connected to the housing system, right? Although Pima County is a little bit different, but we don't always have housing vouchers attached to booking into jail. So thinking about matching that system, getting those, we have a lack of services that are oriented to people and that are tied to housing. So what we're thinking about when we think about this work, as you embark on this work together, right? We're thinking about using Fuse as a mechanism to better understand housing services and need in our community, right? So Ian really set us up really well with these data, right? We don't all have to agree on these data today. These are not complete data. They don't give us a full, we know, right? We're coming in with the assumption that we know we're.
Siri's also got a phone.
Siri's like, what are you talking about, Margaret? Come on. But right, we know, I mean, we're coming in with the assumption that we don't have all the information, right? And we don't know everything that we need to know about all the information that we even do have. So we've got to be thinking about that this is a framework and a process by which we can start those conversations together, right? Together as a community. We also know that we need to connect these resources that are really going to help keep people housed and reunite families, right? I mean, we're not just talking about single adults experiencing unsheltered homelessness, right? We're talking about families, we're talking about family reunification, we're talking about pulling folks from other systems of care, whether it's, you know, DCS or whatever. We're also thinking about how does the homeless response system and our housing system interact with these other systems, right? You all have an amazing crisis response system here in Tucson and Pima County. You all have an amazing housing and community development department here. You all have a justice system that is doing incredible work that's seeing, you know, that's being highlighted across the country. So you have all of these really wonderful components already foundations in your community. You know it, we know it. Now we just have to coordinate them, right? And we have to get them working together. So that is sort of how we're thinking about this as a systems change work and as sector improvement work. How do we get our sectors not only working independently more effectively, but also together more effectively? So if we think about this from, if we're thinking about this from jail, we're going to use jail as the example today, right? If we think about how we can better coordinate, again, it's Matthew, right? If we think about what Matthew, his brilliant comment earlier, that really is just the foundation of the work that we're doing together. Think about this. We've got opportunities when someone at pre-arrest, right? If someone is booked, if someone is released, we heard released from prisons and jail, right? If you're released from jail at 3 o'clock in the morning, what are you going to do, right? If the services aren't, if we aren't changing our practices in these different opportunities, right? We know that there's some incredible work happening at your court systems. We've got some folks here today representing this part of our justice system, right? But thinking about what if we were connecting housing and services, providing those education opportunities right where they're needed, right? This is again that work that we are embarking on together. This coordination, right? Because right now, even though you're doing incredible work, showing incredible outcomes, they're independent of one another. And so what we're trying to do, Liz set us up so beautifully this morning with her quote. It's this work that we're going to be doing together that is going to be leading us to these more effective outcomes because we're going to be more coordinated, right? So these slides will sort of help us set around how that might happen. And hi, Kitty. The kitty says, yes, we're ready. We're going to do this. So when we think about our coordinated entry systems, right? Raise your hand if you, I'm going to say raise your hand if you don't know what coordinated entry system is. Okay. The coordinated entry system is part of your homeless response system. And it is mandated to receive some certain federal funds. Each community has to set up a coordinated entry system. And what that means is that theoretically, ideally, you have a coordinated system where folks experiencing homelessness can access resources, be prioritized for those resources through a coordinated system, right? That regardless of, ideally, theoretically, now this isn't in practice, okay? I'm not saying this is happening in practice for those of you who are familiar with coordinated entry. But ideally, we're able to have a system that folks can easily access, and they are prioritized, and they are moved quickly into housing. This is the ideal, right? This is the purpose.
Instead of every person for themselves on the left, you have like on the right the assignment of choice, the assessment of need, the assisting toward housing, and then the assignment based on choice. That's optimal.
And again, we know that may not be happening. I mean, we know that it's not happening in every community, but what this does is it helps us, again, use a framework for when we have this, where we've got no coordination, where we have some coordination here, we can see that impact is theoretically more effective, and the outcomes are theoretically better for people, right? But the reason that we bring up the coordinated entry system in this conversation is so that we can see that this work, these past two slides, we're really talking about improving systems. We're really talking about when can we start to understand that maybe our coordinated entry system isn't necessarily capturing everyone, right? That's part of these data conversations, that there are folks who are hitting our jail systems or our emergency rooms, our crisis systems, but that even though they should be known to our homeless response system, maybe they're not. So we need to think about, again, what are these opportunities as we move through this work together, as we set our goals and priorities over the next 2 days, how are we going to do that work together? And so these are just, again, setting that framework. Did you have a question?
To me, I still don't understand because it seems like when you were defining coordinated entry system, you were saying coordinated entry system is a coordinated entry system.
Oh, sure, yeah,
Don't
no,
know
that's,
what it is.
so Ian was doing a much better job. So it is a process that folks who are experiencing homelessness, it's set up in every community receiving certain federal funds. What happens is each community determines an assessment process, right? So as people come in to the coordinated entry system, they receive an assessment, right? And so that assessment is meant to evaluate what that person's needs are, right? So it's meant to say, so as you've seen here, all of these people are coming in, and as you see, they're assessed, and then they're provided with some resources based on that assessment, and then they are provided recommendations for that next step, right? Whether it's housing and services, whatever that might be, but this is sort of the process. Does that clarify a little bit more?
Yeah.
Sorry for that. It's a system of evaluation, but paired with some resources that should go along with it.
Sarah, do you want to say something?
Yeah, I just wanted to say that, coordinated entry system here as well as in other locations, right, it's done by, the folks who are the front line working with people who are experiencing homelessness. I think a lot of folks in the room today who have functioned with coordinated entry creation alone. Yeah, so when we talk about coordinated entry system, right, it is also like community-based organizations and the staff who work for them, right? It is this framework that they then embody through the way that they are interacting with folks, making those assessments, helping people to reach the type of assistance that they need, and ultimately in housing. And there's a number of organizations who function as part of the coordinated.
Yeah, thank you, Sarah. And I want to also say that this is part of your continuum of care or your homeless response system, right? And the reason that, again, we're talking about this is because that is it is one of the things by which, one of the pathways by which we want to think about how are people being served today and what are we trying to achieve for folks in the future as we embark on this work together. So because we know that it's like coordinated entry system is happening and it is working and it's doing wonderful things to get people into housing. And we also know that there are other folks that are not going through that. And so we want to think about this as the whole, not just the coordinated entry system, but all of it and how does it work together, right? That really is what we're going to be embarking on over the next couple of days, if that clarifies. So I'm going to turn it over to you to talk a little bit about race equity.
Great. So with use, there are certain things that are non-negotiable with use. Supportive housing. We talked about the definition of supportive housing. Non-negotiable. It's not fused if it's not supportive housing. Data sharing. Hopefully, it's evident. Non-negotiable. You have to have data to make use happen. And I argue strongly, racial equity and lived experience non-negotiable. You can't have cues without racial equity considerations and without lived experience. And so it starts basic, very basic, with the collection of segregated data like I explained before, on at least race, ethnicity, gender, age, family composition, and others. And it's not necessarily looking at those in silos, but also the intersections of them. Because what we find is if you hold more marginalized identities, likelihood that you're also going to be impacted is very, I would argue, is quite high. And so it's important not only to be mindful of the demographics, but also the intersections of them. I stand here as someone who's white identified and male, and that's one perspective. It must not only be the only perspective, not only in the data collection conversations, but the analysis conversations, interpretation conversations, and the results and the communication of them. So that multiple perspectives and centering the experiences of people who are BIPOC, that is Black, Indigenous, people of color, and also with lived experience of systems is vital, critical, non-negotiable. And so the work that we do to develop work groups, the agendas that we set, the timelines that we set, must have to incorporate those perspectives. Full stop. And so that's, this is the start of that conversation here. The engagement of different perspectives of different communities of lived experience must be intentional. And then when folks are in the room, acknowledging which perspectives are in the room, and then also acknowledging which perspectives are not, and then wondering why and how to do it. And so that is practice I try to make sure that that's practice for any meeting that I'm in. And I would encourage you to do the same because it's only strengthening my work. And so that's what I believe in, and what we try to use the expression, but infuse into the process. Oh, and there are resources out there. This is not something that's new. People have done this. And so HUD has a cadre of tools that I would be happy to make sure are included in the slides when they go out that talk about racial equity, they talk about how data is analyzed using specific practices that disaggregate data connecting to the census, things like that. And also CSH has a tool too by happenstance called the Racial Disparities and Disproportionality Index. I call it a tool. I usually don't want to call it a tool. I call it either an approach or a methodology, more accurate. And without going into the finer details, if someone wants a math class, hang out, I'm happy to talk about it. But the brass tacks of it is that the disparity index is viewing the likelihood of one group experiencing an event compared to the likelihood of another group. So it's relative. And it decenters, when we're looking at the entire population, it decenters the white experience as oftentimes when data are looked at by race, the white experience, because of historic, systemic, and institutional racism, performs best. And so everyone looks at disaggregated data and looks at the white experience and says, why can't we get everyone there? And the index changes that by decentering the white experience as optimal or normative and saying, what do we actually need? Because it could be that even the white population, though in my hypothetical, although it happens a lot, the white experience doing better than all other groups, they may not have what they need either. And so looking at the entire population and seeing the relative experience of each one of those groups, it doesn't have to necessarily be by race. You can apply this methodology in a number of contexts and for a number of variables. But we use it with race a lot. And so it goes into things like targeted universalism, where we looked at a universal goal that everyone should be able to achieve, and then figuring out what are the strategies to get everyone there. And so this is the first step in trying to advance that kind of agenda. Okay, so, and I'm going to show you the RDBI for Arizona in just a second, but just in terms of interpreting it, when you see an index of 1, it means that anything times itself, so 1 times whatever is itself, right? So an index of 1 means the same across all groups, right? More than 1 means more likely, less than 1 means less likely. And so that's just rule of thumb how you can view this. If you want to play around with it, you can go to csh.org/data. And then there's some visuals there that you can look at and discover for yourselves, kind of what everything is. But this is the disparity indices for Arizona. It's based on public data. I believe the sources are also included on the website, so you can know which ones are included and for what and why. A lot of stuff around that. But the main thing is to look at these bars, and the bigger the bar, the more likely that group, that race group, is to be part of that system. The smaller a bar, the less likely, generally. And so you can see in homelessness, in child welfare, in justice, in jail, that particularly Black and African American people are overrepresented. In some instances, like homeless families, by a lot, almost eight times more likely to be part of the homeless family of homeless families than other groups. And so this again is a first step in identifying disparities in the community and opening up the conversation about what more data do we need, what more perspective do we need to gather, who do we go to? Sorry, I don't want to get too far ahead.
One thing I want to say about this real quick though is like, you don't need, I mean, this is like, RDGI is a great tool and it's interactive. You don't need to like wait on anything to like start looking at this in your own program. I worked with a program actually here in Tucson where we looked at this and we just said, okay, who's being referred and most successful in this program? And then we looked at what does that look like versus the population of the people, like the referral group, which was jail, right? And do those maps. And then also, what does that look like for the community as a whole? So we looked at the jail demographics, we looked at this program demographics, and then we looked at the demographics of the community. And it told us a lot, right? It told us a lot about, but it didn't answer questions for us. Like it brought up questions that we needed to ask ourselves. What does our referral process look like? How are we engaging people? All of these things become very, they can be things that you might not be thinking about if you're not even asking these questions about your programs. So it really is important to just even in the most basic ways with the information that you do have about your own program, you can start to do these analyses.
Great. Just a question. Are you aware of racial disparities presenting in your community? And if so, how do you know? And I don't need to challenge you on like what data do you have, it's just like, how do you know? It's fine to have a personal experience, bring that forward too. So I'm gonna try this a few more times. Hopefully it doesn't crash on me. And if you'd rather just say something loud, then raise your hand and we're happy to chat. Yeah. Oh, hold on a second.
I'm curious, so would be, is it appropriate to look at informal, locations, so to speak, you know, like here in Tucson, we have, Casa Maria, what is it, per se, that, feeds a substantial amount of the homeless population and things through there at some point, you know, some folks frequent it quite regularly, and some just poor folks for housed and stuff also go there. But, is that because so many folks within the homeless community are reluctant to coordinate with services and such, or, you know, there's rifts sometimes, but do we think that perhaps, some of the less formal, measures, you know, like,
Yeah,
if you go to eat at Casa Maria and you notice that, you know, each time it seems as though, you know, if you took a tally, approximately 2/3 of the folks were, you know, African American, you know, a quarter were, you know, Hispanic or something like that, that might be one of the ways to balance.
Exactly. I mean, it can start, it should start somewhere, and it can absolutely start like that. So, yes, is the answer to that question. Yes, those are all valuable contributions to this conversation.
Good. Sharon, did you have something as well?
Oh, I was just saying, I was just going to say that this reminds me of the National Institute of Health is trying to get millions of people in their All of Us program. And the reason they are doing that is because of the underrepresentation of qualified medical care for people of color.
Yeah.
And so they're doing a lot of research for that, but they are emphasizing the fact that they need other populations represented, like old people, like et cetera, et cetera. So there is other work going on.
Yeah.
In that regard.
Yeah, thank you. What was it? What was it? Everyone, what was it? Everyone?
All of us.
All of us.
And it's, the local coordinator is doing.
Oh, great. So just in case, just for everyone, the comment was about the National Institutes of Health, the All of Us campaign program, and Banner Health leading it locally, right? Okay. And the underrepresentation of people of color.
These are great comments and questions that I want to keep going. Yeah, I want to keep going with those. So we're gonna continue to pull out these questions. In our last few minutes, we're gonna just talk quickly about the importance of partnerships. I have to give a shout out to my colleague Brian, whose 6-year-old daughter created this great slide that I will hope to use indefinitely because it is adorable. And partnerships, right? Chicken and waffles, macaroni and cheese, peanut butter and jelly. I love it. But does somebody have we want to talk about this slides more?
I know it's kind of punishing. We did this so close to lunch.
Okay, but we want to talk about partnerships to engage. And again, I've talked about this ad nauseam. I know that there are incredible, strong partnerships already in place in this community, and we're not talking about taking something over. We're not talking about coming in and taking over on something that's already working really, really well. But we are going to need to have these partnerships in place in some relationship to this fused work in order for it to be done really well in our community, right? So we want to have, again, we know that the folks who are closest to these issues are the best suited to provide solutions to this issue. So if we are not starting, again, Ian said full stop, these are non-negotiable. TPCH, right? We know that this is, a critical partner, and all of the homelessness service providers that are in the room today. TPD, Homeless Outreach, Pima County Jail, Pretrial Services, all of these partners are going to need to be working together, right? Our behavioral health system, our regional behavioral health authority. Thank you, Patty, again, for representing Arizona Complete Health today. Our crisis response center, so glad that we've got representation here today so that we can start to bring these back to our organization and think about what are the roles that we're going to be playing. Emergency, hospitals, federally qualified health centers, right? Our El Rio, who's not too far away, Cherry Bell, beautiful. Substance use treatment systems, U of A, thank you again for being here today, but our research partners, all of these are folks that we really want to engage. And then we want to make sure, again, that we're talking about this already, but we want to, again, make sure that we're doing this sort of non-negotiable work of including people with lived experience. And we've got another, so thinking about this, as you leave today, and you don't have to answer this right now, I don't want to keep you past noon, but this is going to stay open for a little bit so you can answer this. What groups and partnerships exist now or need to be strengthened or created new ones in order for this effort to be successful, right? So what's happening now that we can use as a foundation for this work together? What is there anything that needs to be strengthened, something that is working well but could use a little bit more capacity? Or is there something new that we need to create in order for this work to be successful? So thinking about that, this is our last slide of the day. I know we want to get folks out for lunch because we're returning for our afternoon sessions. This is great. Oh, Youth Action Committee, wonderful. But we really want to hear from you all. Please give us the feedback here so that we can incorporate that as we move forward through the rest of the day. Again, I know we ran a little short on time, but certainly if folks have any questions before we break, we're going to be back at 1 for some smaller groups and some modeling.
Yeah, in various rooms.
Yeah, in various rooms, but same general location. I do want to thank you all so much for your time and attention today. Yep.
I would like to maybe more of like an outreach group or something that targets people like myself, for instance, that don't utilize or abuse the emergency room system.
Yeah.
We're constantly going to the emergency, we're constantly going to jail just because we want to be on the street.
Yeah. Yeah, definitely that has to be in, yeah, that has to be, for sure. Thank you. Any other questions before we all head out to lunch or here? Otherwise, again, thank you again so much for this morning.
Thank you.
Thank you.